today we are joined by Joe Creed and Annette Bradley. You are delivering a joint presentation at the NLP conference next year, and very interesting. I think it's going to be too. So it's actually called, which I think is a beautiful title, Seeing the Person, Not the Condition. So perhaps you'd like to tell us a little bit more about yourself and your presentation.
Yeah, sure. I'll start. So yeah, I've been training in NLP for what is it now? 11 years, I think. So I'm a trainer of NLP. Previous to that, I worked in healthcare. I worked in primary care. I was a business excellence director. I actually had quite a big experience of not seeing the person and only seeing the condition. When my dad passed away, I had a horrendous time over that 6 months. I won't go into in detail, but it really highlighted to me that there was some very, very good people out there in healthcare that do it. And also there were some very good people in healthcare that don't do it because of lots of reasons, time, challenges, moving goalposts, everything else like that. But I realized that there was a massive need to train people in how to, healthcare professionals, whether that is people in the NHS or people that work in health and wellbeing space with alternative health or whatever it is, to actually train them to be able to see the person and make the big difference. And also to help patients and their carers and their family to be able to do what they can to be able to make that real difference. I've been working with healthcare professionals and healthcare organisations for the past 12 years and for 7 years before that as well. But I kind of found that I had all the NLP skills, the communication skills, I had a background in psychology and business psychology, but for me, there was sort of something missing that was helping me get into it and really make the difference, which is when I met Annette. So I'll let Annette tell you a little bit about herself.
Yeah, I started out in the NHS as a nurse 40 years ago, and progressing through to become an advanced nurse practitioner. Also a senior lecturer at university, and I had a lot of instances where patients would come and there was just something there that I got the knowledge, I gave them education and details about their illness, and we talked and we prescribed, and still they'd come back in another 6-12 months and nothing really had changed. And during the last few months, years especially, motivation was low, and I even considered leaving the health arena because of that. And I knew I wanted to make the difference, but again, I couldn't find that certain something that would help that. And then I met Joe, and together we found that we'd both got the missing links between the healthcare delivery and the patients, carers, relatives.
Yeah.
So
what we did was, over the last 18 months, is that we basically developed a way to teach health professionals how to make a real difference. I mean, I've been working with healthcare professionals for so long, and like Annette said, there are so many of them that are thinking about leaving the service, that are so demotivated, particularly after everything's been happening over the last 18 months, 2 years as well.
Oh, yes.
So we got together, we developed a program, we worked with lots of, GPs, pharmacists, nurses, other people to kind of really define it, to be able to take it out there. And we've got a joint passion. As we said, there are so much, the NHS have been saying for years and years and years, person-centred is the way that we need to go. And yet there was lots of
tagline.
Lots of taglines, lots of top level stuff, but no real how do you teach people to do it?
Yeah.
With all the challenges they've got. So that's what our program is, that we're now starting to deliver out into healthcare organisations. But as I said, it's a joint thing. So the idea of our session, our presentation, is for two sides. It's for anybody that's working with anybody that's got a long-term condition, whether it's your standard diabetes, you know, high blood pressure, chronic kidney disease, or whether it's some of the things like multiple sclerosis or anything, you know, chronic pain, anything that's over long term, to help them really understand how they can make tiny tweaks actually to their consultations, but make a real difference to the patient experience and actually the clinical outcomes as well. And then the other side of it is actually, how do you know, I've been there, I don't know if you have, Karen, I'm sure some of the, you know, you find that you're being seen as a number, or you're just being treated for X condition. So how do you empower yourself, empower your family members as well, by just the way that you communicate, the things that you ask, the key questions, the way you put yourself across, to really optimize the chance of them actually seeing you and hearing you and treating you different. So that's what the presentation's about.
I mean, that sounds absolutely wonderful. And is that, did I understand you correctly when you said that, so if people are working as coaches, if they're working with someone with a chronic condition of some sort, you're going to empower the coach to assist their clients with, that's what I thought.
Yeah,
I mean,
absolutely.
That's an incredibly powerful thing to be an incredibly powerful gift to give people, isn't it? Especially at the moment. And I know it is challenging for the NHS. You know, they're massively understaffed, under-resourced and everything like that. So actually it's really important that any support we can give, you know, the more support we can give, the better.
Yeah, absolutely. And it's
indirect, isn't it?
Absolutely. And for the people that they are coaching or working in alternative health or whatever they're working in, not only how can they empower the person they're working with, but how can they empower the person they're working with when they're outside of their room? You know, there's a huge thing at the moment about integrated care systems. So it's a smooth patient journey. But again, not much on the how. And so how can they empower them to do the most that they can do to optimize that, really?
And that's the same, really. It's sometimes, you know, when you do a training course of any sort, I think I've often heard people say, oh, it was great when I was in the training room, in that little bubble of safety and security. And as soon as I went out into the outside world, it all got a bit different. And I know, you know, I mean, it's sort of, when my kids were younger and still at school, I kind of suddenly felt like the small student again when I had to go to the teacher meetings. And it's similar with healthcare professionals. It's that very thing about walking into a hospital or a GP surgery or something. There's kind of potentially just labels or anchors attached to that sort of thing, aren't there, that that people could quite easily be empowered to resolve for themselves.
Yeah, so, and some of it's just doing a little bit of pre-thought beforehand, just being really clear on what it is that you actually want from it, and how am I going to get it, and how do I express that? So that's what we want to really try and bring in that session.
Well, and you said, you know, I do have personal experience when I had to go and have day surgery, and I was watching the more elderly lady across the way from me in the waiting room, and she was there with her sister, and they went in for her, I don't know what you call it, but the pre-op chat beforehand, and they'd been quite jolly and everything. And when she came out of the pre-op chat, her entire physiology had changed completely, and she walked back towards her sister and slumped down in her chair and said, well, that's it, I'm going to die. And I thought, it's day surgery. I don't know what you're in for, but it's day surgery. It can't be that significant that you're likely to die as a result. Then I went in for my chat and noticed the language, you know, the embedded commands. I was going to feel this, I was going to feel that, I was going to experience this. And of course, luckily with my NLP, it was kind of, I had some filters that I could put in place. And then, but I really understood what that poor lady had gone through at that point. And I thought, that's just so sad. So I think anything that can, you can say that.
I'm quite new to NLP. I've known about NLP, and I met Joe quite a few years ago. I've just been trained by Joe, And you saying about being in that bubble of teaching, once I'd been in the teaching and we'd put together, and we were talking about the aligned care, I actually went out in practice and put it into practice, and it was fantastic. So, you know, from both sides, NLP and healthcare, it's just amazing the difference that you can make.
That's so powerful for you as a team as well, because you're actually doing it, Annette. You know, you are walking the talk. Yeah. And that makes it incredibly powerful, and also incredibly powerful for other healthcare practitioners, I would imagine, because they're receiving that information from somebody who knows what they're talking about. I mean, you know what you're talking about as well, Joe, obviously, with your background, but it does make such a difference. Meeting people in their map of the world.
Yeah, that's why when we met, because Annette's got the clinical side of things, I've got the NLP, the communication, the background psychology, the business side of things. So bringing those two together means that what we're doing is, well, to be honest, it's quite unique as well.
Yeah, absolutely. So going back to the conference, because I'm sure I could probably talk about the NHS all day. So what will delegates take away from your session at the conference?
They will take away, from a carer, patient, family member, they will take away some real understanding of how to put their own map across, how to put their point of view across, how to really prepare for a consultation, to be able to optimize, because to be honest, it's negotiation. A lot of it's going to be a negotiation. So how do they really prepare for that, to actually be able to empower themselves? And also, how do they put their boundaries up to be able to strengthen themselves and not end up like that lady that you said, where she's being constantly impacted, and be able to give feedback? For them, it's all about making little shifts, to be honest. So how can they give feedback to a consultation that works really well and doesn't work really well? You know, giving feedback to that consultant that was with you and was with that other lady about, do you realize what you're doing here and what impact that is having? So it's from a patient and a carer and family member point of view, it's some real meaty stuff that they can then share with other members of their families as well to make the difference. And then from a healthcare, do you want to cover the healthcare professional?
Yeah. So for those like myself who are quite frustrated and work in healthcare, and anybody that works with people in well-being, so coaches, social prescribers, nurses, etc., I was feeling that frustration, and our session will just help them to get their mojo back. I was a different person after I practiced the techniques and that, you know, with patients. I even had patients saying that I'd saved their lives because, and I didn't even really do anything, just sat and listened and you know, let them look at their own healthcare plan. So I think from my point of view, from a healthcare point of view, they will take away that spark that's possibly missing at the minute, and knowing and feeling that they are actually making the difference that they went into healthcare to make. You know, so that's invaluable that they'll take from our session.
Absolutely, thank you. So is there anything that delegates can do beforehand that's going to give them a deeper experience during your session?
From sort of healthcare coach, health provider, I think it would be a good idea for them to think about instances where they have encountered patients, clients who have been frustrated, or themselves where they've been unable to make that difference, to bring that to our session to see, you know, what happened, to discuss it, and then look forward and how to improve that in the future.
Brilliant.
And I think from you know, anybody that, well, we've all been patients, but all of us that have been patients or family members, to just maybe step back and have a review of, when did you receive really good patient care where you did feel seen and heard? and when didn't you? And for you, have a think about what was the difference between the two. I think that would really help people to get the most from the session.
I'm just jotting this down because it's brilliant. So I mean, we know, next year's conference, like this year's conference, is being held in a virtual environment. And there are many benefits to that, I think. We're learning more and more every day as to what the potential benefits of that are. So how are you planning to add value in a virtual environment?
It's going to be quite a varied session. Like I said, it's covering sort of both angles. There's going to be lots of stories, lots of examples. We've got some brilliant, as Annette said, when she went out into practice, when other people learned this stuff and went out to practice, we're going to really share some real high impact stories. We'll make sure there's plenty of time for open discussion, and also the breakout rooms. You can try it on. You can actually try some of this stuff on and see what difference it makes as well.
I think as well, we're engaging with people, whoever they are, whether they're caregivers, patients, relatives. They'll all be able to recognise in our session themselves and their frustrations. So it's engaging people in a wide audience.
As I say, sadly, this is something that does impact everyone one way or another, doesn't it? Because either as a patient themselves or as a family member, it's going, or as clients, a coach of clients who are going through that sort of thing. There is something for everybody by the sounds of things, which is sad and really good.
The other thing is what we're also happy to share. I suppose it also thinks about people that, a bit of preparation, getting NLP out there into the NHS and into health. So we're happy to share a bit about how we've done this and the approach that we've taken. And that may help other people, because for us, it's about making a big difference.
Yes, absolutely.
I own a training company for nurse education for quite a few years, and we've started now within those training sessions, including especially things like with the consultations and assessing patients, not just for long-term conditions, but in all our courses. And the evaluations have been excellent. So it's obviously needed and wanted out there.
Like you say, it's sort of somewhere down the line, it lost sight of the fact that there are people involved. So I think this is really, really valuable from that perspective, and an amazing gift, as I said, to be able to give to people. So, I mean, Joe, you've been to the conference before, and you're a new presenter at the conference.
I am.
Lovely to have. It's lovely to have the balance here. So, what does the NLP conference mean to you?
Well, for me, I think in terms of the conference, it's just an amazing way. I attended the virtual one last year. I've attended, I think, 4 or 5 of the face-to-face ones.
Where we first met, isn't it? At one of the conferences.
It is actually, yeah. So, and I presented, I think at 3, I think this is my 4th one. It's a really good way to, from a presenter perspective, is to just share what's going on for you, for people, even if they just take a little tiny bit that makes a difference to their practice. But it's also an amazing way to learn. I mean, you see so many different applications of NLP, new ideas, extensions of NLP. It's a brilliant way to learn and also meet some really good people. I've made some good friends from the NLP conference. I know for you, Annette, you had quite a passion about doing this one.
Yes, because it's such a wide area, and the way to spread the word much wider, and reach our legacy, really, which is to improve as many lives for healthcare professionals, care providers, coaches in relationship to healthcare, and also improve care for patients, and this is exciting for me because it encompasses both, as I say, our skills and my skills, and it gives me a chance to let people know just how brilliant it is to be able to reach that legacy and spread the word and get our mojo back.
Oh gosh, yes. Yeah. And the health service really needs it at the moment. I think they've been battered over, well, say over the last couple of years, but I think before then they were being a bit battered as well. So they're long overdue some mojo, I think.
Yeah.
And I think the other side of that is, as patients and family members and caregivers, we're battered as well, because and I think, you know, it is just that, I think it's being able to put across what the impact of this is. I mean, I don't know if you've had any blood tests or anything like that. The standard thing at the moment is to send you a text with your blood test result on.
Oh, nice.
But that's a quick way. The positives, the way they're thinking, oh, it's making sure it's less doctor time, it's making sure you are getting your results quickly, but they're not thinking about the impact on the person that's then looking at that.
What does that mean?
What does that mean? And then the stress of it and everything else. So you need to be, we need to be putting our voice forward as patients and going, this is actually the impact of this.
Absolutely.
This is a better way of doing it. So that's what we want to try and put across as well.
Absolutely. Oh, it sounds really, really empowering, your session. I'm really looking forward to it. So just to remind everybody who's watching this, your session, Annette and Joe, your session at the conference is called Seeing the Person, Not the Condition. And you're presenting on Saturday, the 21st of May, 2022, at 15:30 BST. Thank goodness it'll be summertime by then. And we've got 3 hours. So a lot of time for people to get really, really involved with this and in depth. And there will be, because it's a 3-hour presentation, there will be a 30-minute break in the middle somewhere. So thank you both so much. I think what you're doing is it's really touching my heart. So thank you, and really looking forward to seeing your presentation next year.
Thank you very much, Karen. Lovely to see you and speak to you again.
Yeah, thank you. Thank you.